Hello friends. In this video, now I will be talking about clinical significance of Pons. So who will be reading from Snell's Neuroanatomy. So let's begin. Clinical significance of the Pons. The Pons, like the medulla oblongata and the cerebellum, is situated in the posterior cranial fossa lying beneath the tentorium cerebelli. It is related anteriorly to the basilar artery, the dorsum celli of the sphenoid bone, and the basilar part of the occipital bone. In addition to forming the upper half of the floor of fourth ventricle, it possesses several important cranial nerve nuclei: trigeminal, abducent, facial, vestibulocochlear, and serves as a conduit for important ascending and descending tract like corticonuclear, corticopontan, corticospinal, medial longitudinal fasciculus, medial spinal, and lateral lemniscate. Not surprisingly, therefore, tumors, hemorrhage, or infarcts in this area of the brain produce a variety of symptoms and signs. For example, the corticopontocerebellar tract will produce marked cerebellar ataxia, and voluntary movement are accompanied by a rhythmic tremor that develops and becomes further accentuated as the movement proceeds. Intention tremor. So first of all, we will talk about tumors. Astrocytoma of the bones occurring in childhood is the most common tumor of the brain stem. The symptoms and signs are those of ipsilateral cranial nerve paralysis and contralateral hemiparesis, weakness of the facial muscle on the same side. So weakness of the facial muscle on the same side. Weakness of the lateral rectus muscle on one or both sides due to abducent nerve nucleus due to injury, due to tumor. Nystagmus vestibular nucleus. Weakness of jaw muscle due to trigeminal nerve nucleus. Impairment of hearing due to cochlear nuclear. Contralateral hemiparesis, quadriparesis, corticospinal fiber. Anesthesia to light touch when the preservation of appreciation of the pain over the skin of the face. Principal sensory nucleus of trigeminal nerve are involved, leaving spinal nucleus and tract of trigeminal intact. And contralateral sensory deficit of the trunk and the limb, medial and spinal lemnisci. These are affected, so there will be contralateral sensory defect. Involvement of the corticopontocerebellar tract may cause ipsilateral cerebellar sign and symptoms. There may be impairment of conjugate deviation of the eyeball due to involvement of the medial longitudinal fasciculus, which connects the oculomotor trochlear and abducent nuclei. So second, hemorrhage. The Pons is supplied by the basilar artery and the anterior, inferior, and superior cerebellar artery. If the hemorrhage occurs from one of these artery and is unilateral, facial muscle paralysis on the side of the lesion, involvement of the facial nerve nucleus and therefore a lower motor neuron palsy, and paralysis of the limbs on opposite side, involvement of the corticospinal fiber as they pass through the bones will result. Paralysis of conjugate ocular deviation due to involvement of the absent nerve nucleus and medial longitudinal fasciculus is common. When the hemorrhage is extensive and bilateral, the pupils may pinpoint, that is, involvement of the ocular sympathetic fiber. Bilateral paralysis of face and the limbs is common. Patient may be poikilothermic because severe damage to the bones has cut off the body from the heat regulating center in the hypothalamus. Infarction. Usually, infarction of the bones is due to thrombosis or embolism of the basilar artery or its branches. If it involves the paramedian area of the bones, the corticospinal tract, the pontanibulae, and the fiber passing into the cerebellum through the middle cerebellar peduncle may be damaged. A laterally situated infarct will involve the trigeminal nerve, the medial lemniscus, and the middle cerebellar peduncle. The corticospinal fiber to the lower limb also may be affected. The clinical condition mentioned above will be understood more clearly if the ascending and descending tract of the brain and spinal cord are reviewed. So you have to review this chapter. So this was about clinical anatomy of clinical significance of bones, that is infarction, hemorrhage, and tumor. So that was about clinical significance of bones. Thank you.